This is Jerry Hesch from the Hesch Institute in Aurora, Colorado. And my client presents with rounded shoulders, which could be just normal development, or it could be a migration of the scapula in protraction. What I want to show is that he is weak when we test middle trapezius. So come sideways. Good. Lift your arm up. And I'll test the right side on the count of 3. Don't let me push your arm down. 1, 2, 3, go. And it's so easy for me to drop that down. Okay? And let's test the left one as well. Go ahead and lift the arm up. 1, 2, 3, go. Just so easy. I mean, this is a strong individual, very well built, very active, but he's got weakness there. I want to show you the mobility of his AC joints. Go ahead and lie on your back now. And I'm preserving his privacy. So just observational, these shoulders appear rounded. Okay? Again, maybe he's just made that way. But what I do is I take it a step further and I evaluate spring mobility through the shoulder blade, because I'm capturing the acromion, that's part of the shoulder, this part of the scapula, and I'm springing it oblique, posteriorly, and a little bit superiorly. So we just capture that. I take up the slack there, and now I'm trying to spring it, and there's no movement. Okay? So you have compressed AC joint on the left. And on the right side, I can take up the slack a little. I can take it up, and then I can spring it. You have some mobility, but you are tight on the right, but there's a little bit of motion there. And what I'm going to do is I'm going to push in that same angle on the acromion, but I'm going to pull the scapula away laterally. And pushing on the acromion is going to traction the acromion and hopefully get a little bit of gapping in that AC joint, and hopefully it will self-correct. So I'm going to do that for 2 minutes, and I'll then teach you a self-treatment that will keep this mobile. Let's have you go ahead and lie on your stomach, and I'll show you the self-treatment. So after I restore normal movement to that joint, then you can do a little bit additional stretching and gapping that joint by placing this 5-inch tall, 4-inch round foam under the shoulder on both sides. And you just lay on that. You can do that at home on the floor, and you can turn your head. And you can, and do that for 3 minutes. I'm going to have you do this every day for a week. Then I'm going to have you do it every day, once a week forever. Okay. So daily for 1 week for 3 minutes on each side. And then every week do it at least once, okay? So I'll stop filming now, and then we'll check your response to treatment.
Okay.